In the spirit of reconciliation, we acknowledge the Gadigal and Bidjigal people of the Eora Nation, the traditional custodians of the land on which we record this podcast. We pay our respects to the elders past, present and future, and extend that respect to all Aboriginal and Torres Strait Islander people listening today. Do you have a chronic health condition and/or a disability? Or do you support someone living with a chronic health condition or disability? Hi, I'm Joel.
And I'm Lani, and we're Imperfectly Human. Welcome to Chronic Conundrums, a podcast from the Sydney Children's Hospitals Network, all about our chronically chaotic lives. In our journeys with a chronic condition, we must become expert navigators of the extraordinary, because every day presents a new challenge.
We're here to tell you what to gain from those aches and pains, because we're more than just patients, surgeries, and prescriptions. We're people too.
This episode will be delving into the depths of treatment, all the trials and tribulations of chronic health management and self-management. Diagnostic pathways inform illness experience and treatment, as your medical team prepares the best defense against flares and chronic pain.
Regimes can be rigorous. Your life can feel uprooted by the sudden proliferation of specialist appointments, care plans, medication, even surgeries and healthcare transition to adult hospitals. Treatment is also a fundamental social process, building relationships with healthcare staff, negotiating power and authority within institutions.
Of course, there is a spectrum of lived experiences. No two journeys through chronic illness and disability are the same, but everyone's is equally as important. Joel, what has the treatment of your chronic condition entailed?
Well, with my chronic condition, since I've been diagnosed since birth, basically all these little life experiences to do with my treatment, there's so many. The big one that I've talked about before is having to get a liver transplant. Wasn't strictly treatment of my chronic condition though. It was treatment for a cancer tumour, which I got as a result of the chronic condition. So I had a transplant to deal with the cancer, which can be derived from the condition. But it's also derived from the treatment, because the reason why I got the cancer is because I had liver cirrhosis. And the reason why I had liver cirrhosis was because the drug that's used to treat my condition is toxic to the liver. So I'm constantly taking medicine so that my levels of a vitamin don't get too low.
Yeah.
And if they do get too low, then I'll have a seizure. So my treatment is essentially constant medication around the clock, around the day. The drug is just a form of a vitamin. The amount of this vitamin that I have in a day is about 1,000 times what most people have in a year.
Whoa. Oh my gosh.
Yeah, I'm pretty sure it's something like that.
Yeah.
So it's obviously a lot.
Yeah.
And you can see how that could be toxic, you know. And so treatments involved not only just my own treatment, but setting up systems around me that help me, help prevent me from getting into trouble.
Yeah.
Which has been a long process, as you could imagine.
Yeah. Well, with my medicine, it happened this morning. I don't know if this is just like in my head, but if I don't eat before I take my medicine in the morning, I feel like extremely nauseous.
Right.
There have been times that I'm like, this is quite graphic, but I'm like sat in the grocery store car park just throwing up just because I hadn't eaten before I take my medicine.
Yeah, and it's such a drastic consequence of such a little thing.
And like I slept for about 40 minutes on the train here because that was the only way for me to cope with like my nausea.
Yeah,
like
sure.
I just felt like I could either sleep or throw up on the train. And sometimes it's difficult because, like, I don't have time. It's like I've got life going on.
Yeah.
I had to leave. My toasty was taking a bit longer than expected. It's just stuff like that. But then 40 minutes of nausea was the result of it. Sometimes my grandparents drop me off to my appointments. And in the morning, of course, I have to take my medicine. And my grandparents, they always see me when I take my medicine. I've got like a handful of all my pills. And they're like, oh, Lani, it's so upsetting. And I'm like, yeah, but what can I do?
What's the alternative?
Yeah, okay, it's upsetting. Let me just not take it.
Yeah.
But yeah, I guess it's just come to terms with how it's going to be and trying to find a way to make it more comfortable.
In our journeys with chronic illness, we must trudge through this new terrain and practice our patienthood. Tectonic plates tremble with every change to the course of treatment, adjusting prescription dosages, altering diets, receiving transfusions.
The ground can feel like it's constantly shifting under our feet, but we can keep ourselves upright, and some may refer to this as self-management. Some parents and carers are hesitant to part with pediatricians, as they may not understand how to support a young person who is expected to be working towards independence in managing their health. Continuing through treatment, we are equipped with the tools to become innovators, to reassess and redirect our lives towards independence in self-management and overall self-acceptance.
As chronic conditions are, chronic, transition is tantamount to treatment. Healthcare transition is the process of moving or transferring your healthcare, which may involve specialists, appointments, treatments, medications from children's hospitals to adult services. The quality of healthcare coordination is vital to this journey, with physiological and psychosocial implications if not supported.
Joel, can you give us a bit of insight into your transition?
I was pretty thankful that, in terms of actually physically seeing my doctors, I did have a lot of closure around it. It's been pretty recent, but it's been a long process, as you might imagine. So it took a fair while to get my adult specialists lined up.
Yeah.
You know, we started talking about transition when I was 16. It took a lot of time for my doctors to find the right sort of doctor for me. There was two sort of facets. One was the liver side of things and one was the neuro side of things. The liver was more straightforward because the way that the hospital works is they'll just send all of their patients to the same adult hospital.
Yeah.
So that was a bit easier, but still didn't have the name of the doctor I'd be seeing because I hadn't decided until very late in the process, realistically.
Yeah.
For neuro, it was a bit different because there wasn't a specific place that all those patients go to.
Yeah.
It's a very sort of personal thing. With my condition being so rare and specific, it was really important to try and find the right doctor for me. My pediatrics neurologist thought a lot about who he would send me to. Part of being a pediatrician, the hard part is that you might have a patient for many, many years and then all of a sudden you just stop hearing from them.
Yeah.
You don't know how they're going, how they're going with their health. And you get close to your patients when you're seeing them a few times a year.
Yeah, and you'd like to think they're a bit emotionally involved as well.
Yeah. With transition, it does feel really awkward just suddenly changing and then not seeing that person again.
Yeah.
Which is why I think those final appointments become so important.
Yeah.
Not because you want to be really productive in the appointments, although you might. It's more from an emotional level. Yeah. That you want to have that sort of ease into the change and properly see them and say goodbye and everything. Part of the good thing about moving to the adult world and being an adult more in charge of your healthcare is that you can go to a new doctor if you want. You can, if you don't like your adult doctor, then you have the power to change your doctor, which you didn't really have as much authority over that kind of thing when you're in pediatrics.
Yeah, no.
I've spoken to people in CHIPS, and they were like, oh yeah, no, I loved going to adults because I started seeing a doctor on my own and I was the one in charge. And then when I realized that the doctor wasn't doing too much for me, or they could be doing more, or I didn't really like them as much as I thought I would, I just saw a new doctor, and it was that easy.
Yeah, it's all about the choice that you gain when you're like more aware of what you need, which you didn't really get that choice when you're little. You just agree with what your parents are doing.
Exactly, yeah.
You see who you have to see, and that's it.
Yeah, so I think it's such a big thing going through transition and then just realizing how much more important you are and how much more you can do for yourself.
You're the one that's living in your body.
Yeah, you know yourself best.
Exactly, yeah.
Yeah, nobody can know you more than you. So I think going to adults and having that actually come to fruition is just such a big thing.
Yeah, and it's so difficult to get in the habit of having to like advocate for yourself.
Yeah.
But that's like so important.
I don't think I was as prepared for as I thought I'd be.
Really?
You know? I think I'd been seeing all of my doctors for so long.
Yeah.
That seeing them from such a young age, my parents were always involved.
Yeah.
And then going from that to adults where I need to actually direct the appointment myself or be more involved in that sort of process.
Yeah.
It was sort of a bit overwhelming going to appointment and having to think about what I was going to say. And
yeah. Or you have to write it down in your notes, like what's been happening the past couple weeks. Yeah.
And I realized, I actually have no idea what happened last month with my health. I just forgot. And someone will say, oh yeah, you went to hospital 2 months ago for this. And it's like, that was like 2 months ago. I thought it was like a year ago in my head because it just gets blocked out somehow. I don't know.
When my mom's there and they're like, oh, so what's up? And I'm like, oh, I don't know. What's been going on? Mom, do you have anything to add?
Yeah, that's so how it goes.
Yeah.
And Mum knows everything that happened and somehow I don't. But it happened to me.
Yeah.
So it was just that weird moment of realization that you don't know as much as you think you do.
Yeah.
Yeah.
But you need to get in the habit. Several young patients report anxiety and concern around transition, confounded by adult care services and not knowing what to expect.
Independence, self-management and preparing for transition is another piece in our puzzling lives living with chronic health conditions and or disability. Perseverance through this conundrum is a testament to your determination and resilience. In our untangling of treatment tales, we hope we've provided you with some helpful knowledge and insights to support you to independently navigate your journey living with a chronic health condition and or disability.
For now, this is Joel and Lani signing off, and we promise next time you'll hear from us, we'll still be chronically ill. While we strive to support you on your journeys with a chronic condition, this podcast is not intended to be a substitute for professional mental health advice. If you find any topics potentially triggering, please seek help from a local mental health professional or contact Kids Helpline on 1-800-55-1800 for 24-hour advice.